Osteoporosis, understanding the bone disorder and its implications. Osteoporosis is a prevalent bone disorder characterized by a reduction in bone density, resulting in weakened bones that are more susceptible to fractures. This condition, particularly common in postmenopausal women due to hormonal changes, can lead to severe consequences, including loss of independence and, in some cases, mortality, especially when fractures involve the hip. Definition: osteoporosis is primarily characterized by the thinning of bones, which compromises their strength and increases the likelihood of fractures. Everyday activities, such as bending or coughing, may lead to bone fractures, with the most common occurrences found in the wrist, hip, and spine. The consequences of osteoporosis can be profound, affecting one's quality of life and independence. Notably, hip fractures, challenging to heal, can result in reduced mobility and give rise to further complications. Epidemiology and risk factors. Osteoporosis exhibits a higher prevalence in women, particularly postmenopausal women, owing to hormonal changes during menopause. Several risk factors contribute to the development of osteoporosis, including age, 50 and older, low calcium intake, intestinal problems hindering calcium absorption, overactive thyroid, sedentary lifestyle, thinness, certain medications, such as prednisone, ethnicity, Caucasian or Asian descent, smoking, excessive alcohol consumption, and a family history of osteoporosis. Epidemiology. Osteoporosis is a widespread health concern, especially in aging populations. The prevalence of osteoporosis varies globally, with rates influenced by factors such as genetics, lifestyle, and ethnicity. Postmenopausal women, in particular, are at a higher risk due to hormonal changes impacting bone density. However, it is important to note that osteoporosis is not exclusive to women, and men can also be affected. The aging process itself contributes to a higher prevalence of osteoporosis. As individuals age, bone mass naturally decreases, and the risk of fractures increases. Osteoporosis-related fractures are a significant source of morbidity and mortality, particularly in the elderly. Fragility fractures, occurring with minimal trauma or normal daily activities, are common manifestations of this condition and can significantly impact an individual's quality of life. Risk factors. Several risk factors contribute to the development of osteoporosis, and individuals with multiple risk factors may have a heightened susceptibility. Some key risk factors include age. Aging is a primary risk factor for osteoporosis. Bone density tends to decrease with age, making older individuals more susceptible to fractures. Gender. Women, especially postmenopausal women, are at a higher risk due to the decline in estrogen levels, which plays a crucial role in maintaining bone density. Hormonal changes. Endocrine disorders, such as hyperthyroidism or conditions leading to hormonal imbalances, can contribute to bone loss. Genetics. Family history of osteoporosis or fractures can increase an individual's risk, suggesting a genetic predisposition. Nutritional factors. Inadequate calcium and vitamin D intake can compromise bone health. Additionally, eating disorders or gastrointestinal conditions affecting nutrient absorption may contribute to osteoporosis. Physical inactivity. A sedentary lifestyle or lack of weight-bearing exercises can lead to decreased bone density. Smoking. Tobacco smoking has been linked to a higher risk of osteoporosis, possibly due to its negative impact on bone-forming cells. Excessive alcohol consumption. Chronic alcohol abuse can interfere with bone formation and increase the risk of fractures. Certain medications. Long-term use of certain medications, such as glucocorticoids, for example, prednisone, can contribute to bone loss. Ethnicity. Osteoporosis is more prevalent in individuals of Caucasian or Asian descent, although it can affect people of all ethnic backgrounds. Understanding these risk factors is crucial for identifying individuals at risk of osteoporosis and implementing preventive measures and early interventions. A comprehensive approach to bone health involves lifestyle modifications, adequate nutritional support, and, when necessary, pharmacological interventions to mitigate the impact of osteoporosis on skeletal health. Symptoms. Osteoporosis is often asymptomatic, and individuals may remain unaware of their condition until a bone density test or fracture diagnosis. Early signs may include a loss of height resulting from spinal curvature or compression fractures, leading to a change in the shape of vertebrae. While compression fractures can cause back pain or aching, the loss of height usually does not manifest noticeable symptoms. Symptoms of osteoporosis are often subtle, and the condition may progress without noticeable signs. until a fracture occurs or a bone density test reveals reduced bone mass. Understanding the symptoms is crucial for early detection and intervention. Here are more details about the symptoms associated with osteoporosis. Asymptomatic nature. Osteoporosis is frequently referred to as a silent disease because it often develops without causing noticeable symptoms in its early stages. Many individuals may be unaware of the condition until a fracture occurs or a bone density test is performed. Loss of height. A common early sign of osteoporosis is a gradual loss of height. This occurs due to compression fractures in the spine, where weakened vertebrae develop tiny breaks. As these fractures accumulate, the spine may curve, resulting in a reduction in overall height. However, this loss of height may not be associated with significant pain. Curvature of the spine. Compression fractures in the spine can lead to changes in spinal alignment, causing a forward curvature known as kyphosis or a Dowger's hump. This curvature is often observed in the upper back and may become more pronounced over time. Back pain or aching. Compression fractures in the spine can cause back pain or aching. The pain may vary in intensity and can be exacerbated by certain movements or activities. However, it's important to note that not all individuals with osteoporosis-related fractures experience noticeable pain. Fractures without significant trauma. Osteoporotic fractures can occur with minimal trauma or everyday activities, such as bending, lifting, or even coughing. Fractures most commonly occur in weight-bearing bones like the hip, spine, and wrist. Limited range of motion. Individuals with osteoporosis may experience a gradual reduction in their range of motion, particularly if fractures occur in joints or areas critical for mobility. This limitation can contribute to a decrease in overall physical activity and functional independence. Decreased grip strength. Osteoporosis-related fractures, particularly in the wrist and hand, can lead to a decrease in grip strength. This can affect an individual's ability to perform daily tasks that require manual dexterity. It's important to recognize that while some individuals with osteoporosis may experience symptoms such as back pain or height loss, many others may remain asymptomatic until a fracture occurs. As a result, individuals at risk, especially postmenopausal women and those with multiple risk factors, should undergo regular screenings, including bone density tests, to detect osteoporosis in its early stages. Early diagnosis and intervention can significantly reduce the risk of fractures and improve overall bone health. Diagnosis. A thorough diagnosis involves a physical examination, X-rays to assess bone density, and consideration of risk factors. A bone density test, such as dual energy X-ray absorptiometry, DEXA, is crucial for confirming osteoporosis. Other diagnostic tools, like ultrasound bone density tests, while quicker and less expensive, may not be as widely accepted for osteoporosis screening. Diagnosis of osteoporosis involves a multifaceted approach, combining clinical evaluation, imaging studies, and consideration of risk factors. Early detection is crucial to initiate timely interventions and prevent the progression of bone loss. The diagnostic process typically includes the following key elements. Physical examination. During a physical examination, healthcare professionals may observe signs indicative of osteoporosis. These can include a reduction in height due to spinal curvature or compression fractures. Additionally, the presence of a Dowger's hump, a curvature of the spine in the upper back, may be noted. X-rays. X-rays are commonly used to assess bone density and structure. Reduced bone density, visible as increased radiolucency, may indicate osteoporosis. However, X-rays alone may not provide a comprehensive evaluation of bone density and are often supplemented by more specialized imaging studies. Bone density testing. The gold standard for diagnosing osteoporosis is a bone density test, also known as bone densitometry or dual energy X-ray absorptiometry, DEXA. DEXA measures bone mineral density, BMD, at specific sites, such as the spine and hip. The results are compared to the bone density of a young, healthy adult, and a T-score is generated. A T-score of -2.5 or lower confirms osteoporosis. Other imaging modalities. In addition to DEXA, other imaging modalities may be used to assess bone health. Peripheral DEXA, quantitative ultrasound, and CT scans can provide valuable information, although they may not be as commonly employed for routine osteoporosis screening. Laboratory tests. Blood tests may be conducted to identify potential secondary causes of bone loss. A common example is assessing vitamin D levels, as vitamin D deficiency can contribute to decreased bone density. Blood tests can help rule out other conditions that may mimic or exacerbate osteoporosis. Medical history and fracture assessment. A comprehensive medical history is essential for evaluating risk factors for osteoporosis. Individuals with a history of fragility fractures or those with multiple risk factors may be considered for bone density testing even in the absence of symptoms. Clinical risk assessment tools. Various clinical risk assessment tools, such as FRAX, Fracture Risk Assessment Tool, may aid in estimating the 10-year probability of major osteoporotic fractures. These tools consider factors such as age, gender, weight, height, and clinical risk factors to assess fracture risk. Special considerations. Certain populations may require special consideration in the diagnostic process. For example, men, although less commonly affected, can also develop osteoporosis, and testing for testosterone levels may be considered. Additionally, individuals with specific medical conditions or those taking medications known to impact bone health may undergo more extensive evaluations. In summary, the diagnosis of osteoporosis involves a combination of clinical assessment, imaging studies, and consideration of risk factors. The goal is to identify individuals at risk or those with early-stage osteoporosis before the occurrence of debilitating fractures. This comprehensive approach allows for timely interventions, including lifestyle modifications and pharmacological treatments, to mitigate the impact of osteoporosis on bone health. Prevention. Preventing osteoporosis involves ensuring an adequate intake of calcium and vitamin D through a balanced diet or supplements. Weight-bearing exercises, avoiding smoking and excess alcohol, and regular monitoring, especially for postmenopausal women, contribute to preventive measures. Preventing osteoporosis involves adopting a proactive approach to maintain optimal bone health and reduce the risk of fractures. Key preventive measures include adequate calcium and vitamin D intake. Ensure a balanced diet rich in calcium and vitamin D. Dairy products, green leafy vegetables, and fortified foods can contribute to these essential nutrients. Supplements may be recommended if dietary intake is insufficient. Regular weight-bearing exercises. Engage in weight-bearing exercises such as walking, jogging, and resistance training to promote bone density and strength. Avoiding smoking and excessive alcohol consumption. Quit smoking, as it has detrimental effects on bone health. Limit alcohol intake, as excessive consumption can contribute to bone loss. Screening and early detection. Periodic bone density testing, especially for individuals at higher risk, facilitates early detection and intervention. Hormone replacement therapy, HRT. For postmenopausal women, hormone replacement therapy may be considered under careful medical supervision to address hormonal imbalances affecting bone density. Fall prevention strategies. Implement measures to prevent falls, such as ensuring proper lighting, removing tripping hazards, and using assistive devices if needed. Preventive medications. Various medications, including bisphosphonates, alendronate, risedronate, ibandronate, pamidronate, zoledronic acid. Selective estrogen receptor modulators, SERMs, calcitonin, teriparatide, abaloparatide, denosumab, and romosozumab, are available for preventing and treating osteoporosis. Estrogen replacement therapy, though less recommended due to associated risks, may also be considered. Several medications are available to prevent or mitigate the progression of osteoporosis, especially in high-risk individuals. These include bisphosphonates. Alendronate, risedronate, ibandronate, and zoledronic acid are bisphosphonates that slow down bone resorption, helping to maintain or increase bone density. Selective estrogen receptor modulators, SERMs. Raloxifene and bazidoxifene C mimic the effects of estrogen on bone, contributing to increased bone density. Denosumab. Denosumab, a monoclonal antibody, inhibits bone breakdown by targeting a specific protein, reducing the risk of fractures. Teriparatide and abaloparatide. These medications, forms of parathyroid hormone, stimulate new bone growth. They are administered by daily injection. Calcitonin. Calcitonin, available as a nasal spray or injection, inhibits bone resorption. While less commonly used due to limited effectiveness, it may be considered in certain cases. Treatment. Initial osteoporosis treatment involves ensuring sufficient daily calcium intake, vitamin D supplementation, weight-bearing exercises, and modifying other risk factors. For women, bisphosphonates, SERMs, calcitonin, teriparatide, abaloparatide, denosumab, and romosozumab are viable medication options. Monitoring bone density regularly is essential to assess treatment effectiveness. Treatment strategies for established osteoporosis aim to maintain or improve bone density and reduce the risk of fractures. Key components of osteoporosis treatment include calcium and vitamin D supplementation. Ensuring adequate calcium and vitamin D intake is fundamental for bone health, and supplements may be prescribed as needed. Weight-bearing exercises. Continued engagement in weight-bearing exercises is crucial for maintaining bone density and overall musculoskeletal health. Medications. Depending on the severity of osteoporosis, medications such as bisphosphonates, SERMs, denosumab, teriparatide, and abaloparatide may be prescribed. Regular monitoring. Bone density measurements are routinely monitored to assess the effectiveness of treatment and make necessary adjustments. Fracture treatment. In case of fractures, particularly hip fractures, surgical intervention may be necessary for realignment and stabilization. Wrist fractures may heal with casting, and additional treatments include pain management and rest. Calcitonin injections may alleviate spine pain from compression fractures. In the event of an osteoporotic fracture, the approach to treatment varies based on the type and location of the fracture. Hip fractures. Surgical intervention is often necessary to realign and stabilize the hip. Prompt surgical management is crucial for optimal outcomes. Wrist fractures. Wrist fractures may be managed with casting, and in some cases, surgical intervention may be required to restore proper alignment. Spinal compression fractures. For compression fractures in the spine, treatment may include pain management, rest, and, in some cases, calcitonin injections to alleviate pain. Pain management. Pain medications, both over-the-counter and prescription, are utilized as needed to manage pain associated with fractures. Your health matters. Quali.health